My name is Carrie Broman. I'm a licensed clinical social worker and I am a trainer in Neurooptimal.
Hi, my name's Jennifer Tierney, and I am a neurofeedback provider, also using Neuroptimal.
So, we're here today to talk about what is neurofeedback and where you can implement it in your practice, both as a clinician using it with clients, but also as a client using it for self improvement.
So, what Neuroptimal neurofeedback is a what they call dynamical neurofeedback system, which is different than linear, which is what most people are familiar with. But it does similar actions where it's measuring the brain waves. It's looking for what we call flutters, and flutters are those pattern behaviors, those things that cause our concerns, our conditions, and just our overall behaviors with everything. Something we've been, establishing since we were born, and so those patterns start to run very deep
Mhm.
over time. And what the neurofeedback system is doing is when it's picking up those flutters, you're hearing a little bit of feedback in the music, and
Mhm.
it sounds like a skip or like a record is scratched. And that's just enough for the system to tell the brain, hey, we don't want to do that. We don't want to go down that pathway. And it's going to start training it through those like little skips in the music to stay in the present, to stay focused. And eventually, what happens is those patterns or those pathways, if you will, kind of start to fill in.
Yeah. We have so many habituated patterns of behavior. We drive home the same way. That doesn't mean it's always the most effective or the most efficient way to drive home. It's just become habituated over time. And what neurofeedback is doing is working on neuroplasticity to allow our brain opportunity to introduce more flexibility and choose a different way. It's a dynamical system in that it's allowing the brain to decide for itself which pathways are still efficient and effective and which ones need to be changed. So it's not going to go in and clean your entire system and change everything out or remove necessary patterns of behavior. It's just going to look for places that things can be enhanced and you can do things differently. And as Jen mentioned, by being dynamical as opposed to linear, in a linear system, you have a provider setting the parameters and setting the protocols for what you're trying to achieve. In dynamical, you're allowing the brain to do that for itself. The brain knows itself best.
Yeah, and to go back to your analogy about driving, the way that the skips in the music, you can kind of relate that to like the sound strip on the road where we're driving, we're on autopilot, we're kind of taking the same way every day, we're not paying attention. And the whole point of those sound strips is to tell you, like, basically, wake up, like, pay attention and get back
Mhm.
in your lane. And it's a similar concept with what Neuroptimal is doing for the brain. It's telling it, like, wake up, be in the present, like, pay attention to what's
Correct.
happening.
Yeah. So far, I found that there isn't anybody that cannot use neurofeedback. The only counterindications that I'm really aware of, as Jen is talking about it, we need to be able to hear the music playing and you need to be able to hear the skips and the flutters in the music. So, somebody with any hearing impairment is going to have a really difficult time with using the system. The other place that we're seeing clinically can be somebody that's on a lot of medication. You know, if they're really taking a bunch of psychotropics, hoping to use neurofeedback to come off of some of those meds or to titrate down a little bit. On the front end, you're changing your system that the meds are trying to treat at the same time. So you might find a little bit need for assistance pharmaceutically before working too heavily in neurofeedback.
Right, because eventually what's gonna happen is the medication is going to the dosage is likely going to be overwhelming. So, it doesn't necessarily mean you fully come off meds, maybe you can, but you would at least be able to reduce down your
Yes.
dosage over
Yeah.
time. And it would be, very important to work with whoever your provider is on that.
Yeah.
And we just say, let them know you're doing neurofeedback because it will start to improve and they'll need to help you monitor that.
Yeah. Neurofeedback isn't intended as a treatment modality in that respect, that you're replacing the other things you're doing. You're not replacing psychotherapy, you're not replacing psychotropic medications. It is a brain training device that's optimizing the function of your brain. So it's, again, going to be adjunctive, not in lieu of.
Right, it's a support mechanism for other modalities.